Welcome everyone again to the Legacy Circle Luncheon, our annual luncheon, which we are so happy to have in person and hybrid this year. So we're recording, and we have several other Legacy Circle members and board members and the like joining us online. I'm Susan L., Vice President, Executive Director of the Foundation. We have missed being with you these last couple of years, so we're really excited to be here together. There, I hear the microphone. And it's something that we will treasure getting together and will never take for granted, especially after all the time that we've been apart. For those of you joining us virtually, welcome and thank you for being a part of today's program. We're happy that you can be with us all together in whatever way works best for you. Now, whether you're sitting around the luncheon table here in the room, or whether you're watching from home, or on the go, even on the move, you're among friends who share a common bond of visionary generosity. Your commitment and partnership with the Foundation as being part of our Legacy Circle really gives us all hope. With your estate plan gift or your life income arrangement, you have made an investment in the future of healthcare. Your generous hearts are ensuring support for the causes and programs most important to you: exceptional care, innovative technology, life-changing research, community outreach, medical education, and nursing education. So you are expressing you're creating what will be part of your legacy and our shared legacy for many years to come. So today we honor you and offer our heartfelt thanks to you. Together we're making a very real difference. Now you know that the Foundation links together donors and key healthcare partners. Whether your gift is for Barnes Jewish Hospital, Barnes Jewish West County Hospital, Siteman Cancer Center, Goldfarb School of Nursing at Barnes Jewish College, BJC Home Care and Hospice, Evelyn's House, or research at Washington University School of Medicine, you're making a significant impact. Ultimately, your generosity is ensuring that everyone we serve, now and in the future, benefits from the most advanced and, of course, most compassionate care. We're thankful for you. Now, we have a few introductions to make in the room. We're very happy for those who are in the room that we have Foundation board members and hospital leadership. We're joined by Dr. John Lynch, president of the hospital, and Dr. Angeline Peters-Lewis, Chief Operating Officer and Chief Nurse Executive. We'll hear more from Angeline soon, and Dr. Jackie Martin, who is Vice President of Perioperative Services. So those of you who are online, we're all waving and saying hello as we meet and greet one another. Before we move into lunch, I have one more introduction to make, and that is to introduce and welcome a special guest who is joining us for the very first time, Dr. Angela Clark, the Maxine Clark, and Bob Fox, president at Goldfarb School of Nursing at Barnes Jewish College. Dr. Clark just started this week on May 2nd as president of the School of Nursing at Barnes Jewish College. She is now on her 4th day, and she's here with us. We are so grateful she made time to come today and meet you and hear her colleagues share more about Goldfarb. So I'd like to thank Dr. Clark for joining us and ask if she would like to say a few words. There she is.
Thank you so much. It's been 4 days of the warmest welcome, and I am just excited, grateful, and honestly very humble to be here today with you. So I spent the last decade working on nursing pipeline programs in academia and also doing research intervention programs for some of the most vulnerable populations. So I'm very excited to be in this company today and appreciate everybody in this room. The COVID pandemic has really shined a light on nursing. We have been spotlighted and we have momentum like we've never had before. It's taught us so much about ourselves and also our communities. And from that comes some new challenges and opportunities. And I think together we all play an integral role really in helping to maximize the opportunities that we have given this momentum. So your support has really helped to pave the way for Goldfarb's vision for our future. And as we continue on our path to distinction, which you're going to hear a little bit about from my esteemed colleague, Dr. Ward, you'll also see that through our exemplary education, research, scholarship, and our commitment to our communities, right, that we're going to be upholding our values and our vision, and we're excited to share that with you. So just thank you so much for being here today.
Good afternoon, everyone. Once again, we welcome you to learn more about the incredible impact of your gifts and to thank you for your generous support as Legacy Circle members. Thank you. We're so grateful for you joining us today, and we're grateful for our virtual audience. My name is Angeline Peters-Lewis, and I have the privilege of serving both as the Chief Operating Officer and Chief Nurse Executive at Barnes Jewish Hospital. It is truly an honor to be here with you all today. So please enjoy your dessert, and I have the honor of introducing both Dr. Mayola Rouser and my esteemed colleague who's in the room, Dr. Michael Ward. Dr. Rouser is the Jack Taylor Dean and Professor at the Goldfarb School of Nursing at Barnes Jewish College. She joined Goldfarb in May of 2019 and has been a fearless leader and partner for us at Barnes Jewish Hospital throughout the pandemic. Dr. Rouser came to Goldfarb with a wealth of experience and expertise in higher education, administration, and accreditation, and many of us have tapped into that expertise. From day one, I think we'd all agree that she's jumped in and really embraced her role as the Chief Academic Officer. She is responsible both for educational policy, academic standards, and for each of our specialty areas that are within the Goldfarb School of Nursing. She has been really instrumental in steering the college's vision and really helping to develop the path of distinction. She's well known and is really developing a reputation for leading the work in health disparities across the St. Louis area. Dr. Rouser has really worked on diversifying the faculty across Goldfarb, the staff and the students, all with the ultimate goal of improving the care we provide to patients, families, and the communities that we are so privileged to serve. She's a native of the Midwest in Evansville, Indiana. Dr. Rouser began her career as a nurse in psychiatric mental health. From there, she served in various leadership roles and continued her education. She has both a Doctor of Nursing practice and a Doctor of Philosophy degree in nursing from the University of Tennessee Health Science Center. She's also an active clinician and is a certified family nurse practitioner and a psychiatric nurse practitioner. The previous Goldfarb president, who we all know, Dr. Nancy Ridenour, said that Dr. Rouser was one of her best decisions that she made in her role of president. Joining Dr. Rouser today in this presentation is Dr. Michael Ward, the Vice Dean for Student Affairs and Diversity and Professor at Goldfarb. He has held several faculty and leadership positions throughout his career, beginning before joining Goldfarb in 2008. Dr. Ward melds his clinical experience with academic expertise after spending 20 years at Washington University School of Medicine and Barnes Jewish Hospital. He brings both passion and compassion to his role of working with students. Dr. Ward was actually an excellent student himself and graduated magna cum laude from St. Louis University with a bachelor's degree in radiology sciences. He later earned a Master of Education degree at the University of Missouri St. Louis and a PhD in higher education from St. Louis University. In his current role, where we have the privilege of working with him, Dr. Ward is responsible for leading student services, academic advisors, admissions, financial aid, registration, along with alumni affairs, marketing, and communication. So we wonder, when does he sleep, right? So we're going to start with a quick video, but please welcome both Dr. Mayola Rouser and Dr. Michael Ward, who are going to share with us how Goldfarb is working to prepare the next generation of clinicians, which will ultimately influence healthcare overall. So Dr. Mayola Rouser and Dr. Michael Ward after this video.
Goldfarb School of Nursing has a proud history of preparing exceptional leaders in an academic, learner-centered environment. Built upon the legacy of Barnes Hospital School of Nursing, Jewish Hospital School of Nursing, and Goldfarb School of Nursing at Barnes Jewish College, we are recognized for our quality educational experience, state-of-the-art nursing facilities, high pass rates by the National Council Licensure Examination, and the quality and preparedness of our graduates. Goldfarb School of Nursing lives at the intersection of healthcare and higher education. It builds on best practices in both fields while also looking ahead to educate nurses who will provide care and leadership in a fast-paced and ever-changing environment. This ability to be creative and forward-thinking in both content and methods is critical because the need for nurses is enormous. Our community disparities in outcomes need urgent attention, and nursing research is essential for the discovery and dissemination of knowledge in healthcare. Goldfarb School of Nursing at Barnes Jewish College is positioned to dramatically increase our impact on healthcare and health outcomes. Over the next 5 years, we intend to build on our strengths to become a nationally recognized school. With a strong reputation for both undergraduate and graduate doctoral programs that meet the needs of students and the future workforce. This is our path to distinction. While there are many paths to educating new nurses and advancing the practice of current nurses through graduate education, Goldfarb School of Nursing at Barnes Jewish College is positioned to stand out. The path to distinction envisions Goldfarb as a national leader in nursing education through educating nurses through quality preparedness, community engagement and impact, and research and scholarship. These 3 goals are centered in community need for outstanding nursing now and in the future. To ensure their effective implementation and sustainability, Foundations for Action will operationalize the vision of the path to distinction. The Foundations for Action are unceasing drive for diversity, equity, and inclusion, strong and mutually supportive partnerships and collaboration, clear operational structure, financial discipline, and institutional advancement. Goldfarb builds on these foundations with the 3 bold, interrelated goals. Goal 1, quality of preparation. Prepare students in a diverse, academically rigorous environment to provide exceptional care and leadership. Goldfarb will do this by continually evolving teaching techniques and models to ensure innovative content is delivered in ways suited to students' needs and learning styles. Goal 2, community engagement and impact, reflects our recognition of the way nurses and nursing students can make a difference in their community by addressing health disparities in the region through community engagement and impact. Goldfarb will do this by aligning with the BJC Community Health Improvement Effort for maximum impact and focusing on populations experiencing grievous and avoidable disparities in their health outcomes. Through the path to distinction, Goldfarb aims to model inclusion within the college community and to prepare nurses to drive dramatic progress in health equity. Goal 3, research and scholarship. With the 3rd goal, Goldfarb seeks to improve care through scientific inquiry and application of the best models of care into effective practice and establish Goldfarb School of Nursing at Barnes Jewish College as a national leader in nursing research and scholarship. Goldfarb will do this by recruiting, developing, and retaining outstanding leaders and faculty in support of an integrated research model, creating distinctive research strengths for Goldfarb. The 3 goals of the path to distinction are centered in community need for outstanding nursing, now and in the future. The synergistic power of the interwoven goals and foundations for implementation will propel Goldfarb into a very bright future. Imagine what a Goldfarb graduate could achieve in a lifetime of clinical excellence and leadership. A PhD with a research focus on infant mortality, community-based nursing, development of healthcare policy to advocate for patient populations, a bioscience entrepreneur role, a leadership track in BJC or a local nonprofit. Imagine what's next. With this combination of rigorous academics, community engagement, and a drive to reduce disparities, and an innovative research and scholarship effort, Goldfarb nurses can make a significant difference in the world, beginning in St. Louis.
Well, good afternoon, everyone. It's my great pleasure to be sharing with you today. What's great is to see so many faces that I recognize. So it's great to be able to speak to an audience or your friends rather than a bunch of strangers. So I know that there are a lot of folks that are viewing remotely, and I saw the names of some of those, and many of those individuals I recognize as well. So thank you again for allowing me the pleasure of speaking to you today on behalf of Dr. Rouser and myself. Dr. Rouser had a family emergency that she was to take care of and drove back home to take care of that. So I'm speaking on behalf of both of us today. You know, when I was a little boy, I was somewhat mischievous, and I was one of those that would make fun of people. My grandfather, I got that from my grandfather. And what I would do is, I remember asking my grandfather, why are people putting on a different set of glasses when they are speaking, or when they get up and get to a podium? And he would jab me and say, Michael, just you'll find out one day. So I have become one of those people that has to put on a different set of glasses in order to read. So I tell folks, be careful what you make fun of when you're younger, because you'll become that thing. So be careful about what you poke fun at. But today, again, it's so gratifying to share with you this particular important topic. So we're looking at preparing the next generation of nurses. And I might be taking a little bit of a different spin, but we've made sure that we are focusing so much on our path to distinction, which you just saw in the video. But we are imagining nursing education. We're reimagining what it's going to look like. Healthcare delivery will continue to increase in complexity, and the need for well-prepared nurses will continue to grow. At the same time, populations are becoming more diverse, and an emphasis on acute care is shifting to illness prevention and community care models, which in turn expands the need for nurses in home care, school nursing, and public health nurses as well. As a profession in general, and as a school of nursing specifically, we have a responsibility to consider what reimagining nursing for the future will look like. As we consider all of this, as we consider all that is required in the quality of preparation of our students, we also acknowledge and imagine the type of qualifications our faculty will need to ensure that our students receive the highest quality preparation and clinical experiences. The future of nursing workforce and preparation for practice relies on the quality of nursing education programs. Reimagining nursing education may look like this. First, it's attracting faculty with specialized knowledge to how colleges work. It's providing our faculty with proactive and sustained support to build their resilience. It's strengthening our curriculum to promote health equity and reduce health disparities. It's access to evidence-based resources for our faculty who will teach our students on how to translate this evidence into practice. It's having faculty who will utilize technology to optimize virtual learning environments, virtual simulation, and artificial intelligence. Supporting education research to advance nursing education and develop evidence-based teaching innovations and competency-based models which align with national standards for nursing education. That's where Goldfarb School of Nursing is focusing. Strengthening the nursing profession for the healthcare challenges of the future will require a thorough understanding of what is required in education and preparation of our graduates. Well, this is well defined in the path to distinction. This preparation must include training in advanced technologies, use of informatics, patient surveillance and clinical management systems, emergency preparedness and response, and structural and individual determinants of health. Along with the simulated technology that will prepare our graduates for advanced patient care management systems, we will utilize pedagogies that promote critical thinking, reflective thinking, and the evaluation of evidence and its application to practice. Before we can move into transforming nursing education, we have to acknowledge the current and forthcoming challenges in nursing education. The forces related to the demand for medical and nursing services are strongly related to demographic, socioeconomic, and epidemiological factors. The cost of tuition is a barrier for some students entering nursing schools. Simulated technology is very expensive to purchase and maintain, and the next big thing is always waiting in the wings. The entry level for advanced practice will be at the doctoral level. It is difficult to determine at this time what the impact will be on enrollment in the DNP program options into the future. Nursing schools across the nation lose 1/3 or more of their seasoned faculty. Succession planning is imperative. Growing our own from our student body holds the key. At Goldfarb, we have recently hired 2 graduates from our nurse educator program. So we're taking care of trying to address our own needs for nurse educators. Faculty leaving nursing education for higher salaries in healthcare organizations is becoming more enticing. Nursing schools generally can't compete with these salaries, but as I was sharing with my table partners, just like nursing is a calling, nursing education is also a calling. So we are going to look for ways to tap into those who have that need, that passion for wanting to teach in the nursing profession. And that's one of the things that we're committed to at Goldfarb. Short-term measures to overcome the imbalances or the shortages in the nursing workforce, such as hiring adjuncts, is not always reliable or sustainable for the long term. According to Jessica DeVito, undergraduate nursing students with research experience are more likely to pursue graduate education. Community-engaged research mentoring facilities not only help facilitate this process, but also student engagement in topics such as cultural relevance and community partnerships is important. There is a growing need for doctorally prepared nurses in the United States, just as the number of faculty available to educate new nurses is projected to decline as the population ages. Learning about health from multiple perspectives and developing meaningful relationships with communities are 2 critical ways that undergraduate students can think more holistically about health, allowing them to understand how both individual and structural barriers to health shape outcomes. Multiple perspectives gained through domestic and international study allow students to understand better ideas or better issues of issues of social justice, cultural relevance related to care delivery. In many communities, there are substantial challenges that residents are having related to diversity, cultural sensitivity, and adequately prepared workforces. And those are the kinds of things that we at Goldfarb will continue to focus on as we address diversity, equity, inclusion, which too is a part of our path to distinction. Our nursing faculty are moving beyond status quo and are integrating innovative and creative teaching methodologies in the classroom and in simulations. We have to prepare our students to deliver culturally informed care that currently are not assessed in licensure or certification exams. We must focus on advancing health equity in our curriculum to prepare our graduates to address social and health justice to improve patient outcomes. Students must be educated on biased care leading to poor health outcomes and shortened lifespans. And this is a part of our increased focus within our curriculum. Our curriculum will ensure that our graduates will be prepared to provide equitable and unbiased care. Nursing education is holistically rooted in the moralities of care and compassion, and these basic principles will be foundational for why and how we do what we do. We will teach our students that caring for themselves is essential while caring for others. It is imperative that we continue to build partnerships and foster collaborative relationships with our clinical and academic partners, as well as our regulatory and accrediting bodies. As we reimagine the future of nursing, Goldfarb School of Nursing faculty will answer the long overdue charge of addressing health and social inequities in our curriculum. The new standards include competencies based on social determinants of health. Our graduates will be prepared to provide equitable and unbiased care, as I've mentioned, and the college commits to recruiting and retaining diverse faculty and student body. Strengthening the nursing profession for the healthcare challenges of the future will require a thorough understanding of what is required in education and preparation of our graduates. Reimagining the future of nursing will require strategies to create a pipeline that is diverse, equitable, and inclusive. As you saw in the introductory video, the path to distinction is providing us an important roadmap for the future of Goldfarb School of Nursing. As we prepare the next generation of nurses, we must be intentional about the steps needed to address the quality of their preparation in a way that prepares them to serve the communities that we serve. The demographics of our communities are changing, and therefore our students should be representative of those communities. Goldfarb School of Nursing will continue to look for ways to attract and support exceptional, diverse, high potential, and resilient students from various backgrounds. Many of these students will be non-traditional students, which I will describe in a little bit more detail in a few minutes. But with intentionality, we will continue to recruit and diversify our faculty, and because it's because of them in these key roles, they will be leaders in teaching and mentoring our students. Through the path to distinction, Goldfarb aims to model inclusion with the community and prepare nurses to drive dramatic progress in health equity. The college leadership, faculty, staff, and students have adopted a diversity statement that serves as a visible expression of our values. It reads, "It takes the entire Goldfarb community to be an institution of distinction that prepares nurse leaders to serve diverse populations. We embrace and celebrate our differences with dignity and respect. We must nurture an inclusive environment committed to equity in every form." So much of what we do and accomplish is through the strong relationships and partnerships that we have with BJC, BJH, the foundation, and community leaders and partners like those who are attending this luncheon in person and virtually. For the path to distinction, this particular event and many more partnerships are helping our students to realize their dreams to become nurses. I'd love to show graduation pictures at our new student orientations. It helps incoming students to realize that even though they are at the beginning of their journey, many others that have come before them and successfully crossed the stage to receive their degrees have graduated from Goldfarb. So they know at the beginning there's they know that the end will look like this. We are impacting the lives of our students and their families, as significant numbers of our graduates are first-generation students. They are the first in their families to achieve a formal college degree. As they enter the nursing workforce, not only are they prepared to provide evidence-based care for their patients, but they are serving as role models for their family and their community. We must be intentional about the interventions put in place to support diversity in nursing education. Demographics in the United States are changing, and in 2044, minority groups will account for half of the population. Nurse educators need to consider how to propel the profession into the future to meet healthcare needs for a diverse patient population. To be clear, diversity refers to individual, population, and societal characteristics such as race, age, ethnicity, sexual orientation, gender, socioeconomic class, and education. A survey conducted by the National Council on State Boards of Nursing and the Forum of State Nursing Workforce Centers found that nurses from minority backgrounds represent 19.5% of the RN workforce. The number, while improving, does not match the demographics of the current U.S. population. Support of non-traditional students can enhance diversity of the healthcare workforce. Non-traditional students are defined as over the age of 24, and be aware that many of the students at Goldfarb in our BSN programs, the average age is 25. Those whom English is a second language, ethnic minority, or gender minority, and in nursing, males would be considered a gender minority, and those who work full-time would be considered non-traditional students while they are students going to the nursing school. In the path to distinction, our goal is to create a pathway for the retention and success of those non-traditional students. Tailored support interventions for non-traditional students should be provided with intentionality. The pathway should include interventions that address environmental, academic, professional, and include cultural factors. Financial support allows non-traditional students the opportunity to spend more time studying and engaging in student organizations and community involvement activities. So scholarships, that many of those that you make available to our students, allow them to reduce the amount of time that they have to work while they're going to nursing school. That definitely enhances their ability to get more involved with and engage in their nursing education and take advantage of all the opportunities to grow as they are becoming nurses. Goldfarb will continue to address recruitment and support strategies for students that reflect the demographics of our patient populations and the communities that we serve. Aligning with the path to distinction, preparing the next generation of nurses is key to our success. Goldfarb School of Nursing is on a pathway that is focused on several key elements. As we prepare exceptional nurse leaders in an academic, learner-centered environment, we are committed to the quality of preparation of our students, community engagement and impact addressing health disparities in St. Louis, research and scholarship as we establish Goldfarb as a national leader in nursing, building on a firm foundation of unceasing drive for diversity, equity, and inclusion, strong and mutually supportive partnerships and collaboration, clear operational structures, financial discipline, and institutional advancement in philanthropy and brand development. I am so proud to represent myself and Dr. Rouser. I'm so proud to represent Goldfarb School of Nursing today. I'm so proud to represent our new president. I have been on this campus since 1974, and I just want to give a big thanks to Dr. Ron Evans, who mentored me in my youth when I was working in the Department of Radiology. Harvey Harris is someone that I have to call him out because I just like him so much. He's such a great guy and just has always been someone that has cheered me on. And Henry Warshaw, he doesn't recognize this, but even in more recent, with his boldness in thinking and thinking big and being a key member of our Board of Trustees, just a great guy. And I look out here at so many others, as I spoke early, that I recognize their faces. I worked with them for years. I see them passing in the hallways, always supportive, always friendly, and always real. It's important to recognize that when you're working with real people who have real passion for what they do, it's easy to come to work today, on those days, and give it your absolute best. Is everything perfect? Absolutely not. But I will tell you that when you have a pathway to distinction as we have, and as we have leaders that many are in this room today, many are back in the hospital and at the college doing their normal everyday work, but it's because of them that we're able to be here and do this kind of, have this kind of connection and celebration with each other. This particular group of Legacy Circle members, I've read so much about what you do and what you do for our community, what you do for BJC and the hospital. I have so much admiration for that. And it's just great to be able to share for just a few minutes, a few thoughts that some might have been a little provocative, but I hope that you glean some of that, some of the key elements that I think that are so important for what will carry Goldfarb School of Nursing well into the future, well beyond the time that I'll be there. But I'll tell you that it's just exciting to be a part of what is engaging about our community, and we want to continue to be strong partners. And in my years at the college, and I've said this, and then I'll pause and sit down, but I have never seen so much excitement and engagement around what we're doing at Goldfarb School of Nursing. Again, I'm going to call his name out one more time, but Harvey, at one of the board meetings, he stood up and championed the forward movement, along with Dr. Evans, the forward movement of Goldfarb School of Nursing, and they said, we're going to be #1 in the community, #1 in nursing education. Look how far we've come, and we have so much to look forward to. And I'll stop there and just say thank you for your time and for your attention. It's been great.
Dr. Ward. Thank you so much, Dr. Ward. What a wonderful presentation. We do have a few questions from our online attendees, if you don't mind.
Sure.
And of course, if anyone has any in person, we welcome those. And Dr. Ward, if you wouldn't mind repeating the questions from in person so our virtual audience can hear, that would be wonderful. But our first question from one of our online viewers is, can you speak to the nursing research program and how this impacts our students' education and potential outcomes that GSON hopes to see as a result?
I'll tell you this, Goldfarb School of Nursing is blessed to have faculty who are so dedicated to nursing research. We have a program that is designed to encourage our nursing students to be a part of the nursing research program called the REX program. And it's a research experience program. Undergraduate and graduate students have the opportunity to work alongside our nurse scientists, our educators, and do actual research. They're not there just counting beans or those kind of tasks, but they are actually performing research alongside those nurse scientists. So how will that impact our college and the students and the faculty and the path of distinction? If we get students involved with research early, they find out that this is something that is a positive experience, and they too will be encouraged to continue along that path. And with the hopes that maybe down the road they'll be nurse scientists themselves and mentor others that have that kind of interest.
Wonderful. Thank you so much. Before I get to any of the other questions online, does anybody in person have any questions? Yes, absolutely.
Is there a lot of effort in securing new students into the undergraduate program?
The question is, are there a lot of efforts in pursuing increasing the number of undergraduate students in the nursing program? And the answer to that is absolutely yes. There is a need for nurses all across the country. And we're so proud to be a part of BJC Health System and so well connected with our community. So we're doing our best to increase our recruitment of students into nursing. And there's some exciting opportunities that are taking place behind the scenes right now to maybe even make it a little bit easier for students to obtain their nursing degree. So the answer to that question is absolutely yes. And it's through partnerships and our relationships with our community of interest, many of whom are here today. So yes, sir.
Hi, Dr. Ward. Thank you so much for your wonderful presentation. I'm wondering if you could describe the relationship, the partnership that Goldfarb School of Nursing has with Washington University and how it relates to your graduate program.
Oh, very good. So the question is the relationship of Goldfarb School of Nursing and Washington University in our graduate program. We have had a long-standing partnership with Washington University. One thing, the proximity is just perfect for us. So right around the corner and down the street. But our anesthesia program, our CRNA program, has been supported broadly for years by Washington University School of Medicine. So that's been long-standing. Our acute care nurse practitioner program, which is at the doctorate level, is well supported. And the faculty are working very closely in partnership with other scientists and physicians of Washington University to do collaborative research. There's a lot more opportunity waiting for us there, and I know that Dr. Clark is very interested in that. So the opportunities for more and more collaboration with Washington U there's nowhere to go but up. There's just so much more for us to do in that area. Thank you. And Debbie's reminded me, please, I've got to say the PhD program that we have with the Danforth campus. That's going to explode. We're continuing to look for ways to broaden that and other opportunities to work with Washington University. Thank you, Debbie.
Yeah, I was struck by the data showing 19.5% of your student body are underrepresented minorities, I think, and 50% of the population by 2044 will be minority. And so the medical schools are beginning to move towards tuition-free education, medical education, because of the extreme cost and trying to be differentiators and getting the best students. Is there any movement or talk about that for nursing students in order to close that gap, to get really good students, to get them in here without a lot of debt, tuition-free nursing?
I tell you what, there have been many wonderful ideas, and that's one of them that has been brought to the table. And those are the kind of things that we are taking very seriously using that model. Dr. Clark and I, in passing, were chatting about that the other day, there are some very interesting models in nursing where something like that has worked. So stay tuned for more around that. But we're with the kind of partnerships that we have had with the foundation and with BJC and BJH and beyond, all types of ways are being looked at to find how to make the cost of education not be a barrier for those who have a passion for going to nursing school. And why not find a way to make that happen at Goldfarb? So stay tuned. I'm excited about some things that we're talking about behind the scenes, but I think our new leader is going to be a big champion to help make some of those conversations and those dreams come into reality.
Wonderful. Well, we do have another question online, and I think this will be our last, and then we will welcome back Angeline Peters-Lewis. So Dr. Ward, our last question is, the pandemic has impacted practically every institution imaginable. It has posed opportunities as well as challenges. As you reflect on the past 2 years at Goldfarb, are there specific ways in which the pandemic has impacted Goldfarb? Have any opportunities presented themselves, and what about additional challenges?
In summary, the question is addressing the past 2 years. COVID has had an impact on our community, on our world. In essence, how has that impacted Goldfarb? What measures have we taken to address that? And has something kind of good come out of something bad? I'm really paraphrasing there. So I tell you what, this has been the strangest time in higher education that I can ever remember. But I'm going to tell you, and I say it with all sincerity and truth, thank goodness we had already put into place mechanisms of providing education remotely, and it wasn't in preparation for COVID. Who would have guessed COVID was coming? But I'm telling you, as soon as we were told, no more physical presence, stay home, we went into action. We were a tiger team around that building. We were the administration, the faculty joined together, and we did not skip a beat as it relates to providing quality education for our students in a remote process. Now, as again, with my table mates, we were talking about how we need to have teenagers around to help us to work our technology. Well, luckily our students are a little bit younger, so they were able to pivot quickly to the use of technology as well as our faculty. We provided our lectures, the faculty were at home teaching, the students were at home learning, and our simulations we were able to do in a virtual setting. There are tools out there that provide simulation experiences that are useful for educating our nursing students. Is that the best way? It's the best way in terms of how it had to be delivered during a time of pandemic. But that's how we were able to manage that. And our students and faculty and staff all learned how working away from each other was different, but we didn't skip a beat because we do what we do because we like what we do. So we were able to manage through that. So I would love to sit down and talk through this with anybody, but I have learned more about myself during this COVID time. I thought that there would absolutely be no way that I could just be at home all day long behind a computer screen. I found that I can do that, but I don't necessarily like it. So I'm so glad that we're able to get back and be in person with each other. And I bet many of you are so glad too that we're able to share in person as much as we possibly can. So that's what I've learned about myself. That's how the school continued to do its thing to really address quality education for our students. And we're continuing to learn more and more every day.
Thank you, Dr. Ward. What a wonderful presentation.
Thank you so much.
Thank you, Dr. Ward and Dr. Rouser, who I know is with us in spirit, for the amazing presentation, for really giving us insight into the great work and education that Goldfarb is providing for the next generation of clinicians. You know, last week we were at a retreat as a leadership team, and Dr. John Lynch, who's here, he gave us a tough assignment. He said to a bunch of talkers, choose one word to describe your mood, right? And we all unwillingly chose that one word. And the one word that I want you all to leave with today is imagine. Imagine the possibilities in terms of transforming healthcare if we had students who reflected the communities that we serve, were well prepared to help us to eliminate the disparities that persist in our community. Imagine if we had nurses that were prepared to generate new knowledge to transform not just sick care for individuals, but well care for patients and families. Imagine if we had a diverse workforce of nursing, if we had enough and they were well prepared to keep communities healthy, what that would mean for our future of healthcare. And that's what we're talking about today, is not just nursing, but nursing being well positioned to transform healthcare as we know it. And as a nurse and as a leader, I know the importance of nursing, and we all have learned the importance of nursing as we've navigated through a 2-year pandemic. We know that it's a calling, but we know that when those accept the call, that great things happen for patients and families. And nurses have served the community through this pandemic, and what we do know is that as we continue to navigate the pandemic and the challenges of healthcare, we will need more nurses that are prepared in the bold way that Goldfarb has outlined for the students that they serve. So to all, we're extremely grateful for all of our generous donors and all that you are doing to support nursing scholarships, because we know that nursing scholarships is really ultimately going to have an impact in healthcare as we know it. Dr. Ward and Dr. Rouser shared so much great information about Goldfarb. I hope that you were able to learn more about nursing. I hope that you will leave imagining the possibilities. And thank you for your commitment as Legacy Circle members, for your valued partnership, generosity, and commitment to the nursing profession. It has been a great honor to recognize all of you here today. We thank you for your generous gifts and the special legacy that those gifts will create for generations to come, and the dreams that will come true for those who want to pursue nursing as their profession and answer the call. If you ever have questions about what's going on and what nurses really do and how this education really impacts healthcare, please call any one of us and we'd be glad to spend time with you, not just talking about nursing, but actually showing you the impact that nurses make on the lives of patients, families, and communities. As we work towards getting healthy communities, nurses play a very important role in that as well. So it is great to see your smiling faces, great to see you in person, and we thank you for giving us the gift of your time this afternoon. We hope to spend time with you again, but for today, we wish you a very good a great afternoon. Thank you all.